Matthew, and today we're going to talk about Vivitrol. So, what is Vivitrol? What does it do, and why would someone use that in the context of addiction? Vivitrol is a medication which blocks all opiates from working. There's another medication called Narcan, which we give to people if they overdose. Upon administration of Narcan, we completely reverse someone's opiates and make them breathe again if they've stopped breathing. In the purpose of Vivitrol, what we do is we give an injection, and you have a 1-month episode where you have blockade of all opiates. The advantage of this is that if you were to use opiates, you generally can't get high, so that is helpful. But it does not prevent withdrawal symptoms, and while it may reduce cravings in some people, it doesn't in all people. It can be a very effective medication for certain individuals, but it's less effective than Suboxone or methadone. Generally, when we look at success rates at 6 months with methadone or Suboxone, we're going to see about a 60 to 65% continuation rate at 6 months. When we look at the sobriety rates with Vivitrol, it's closer to 15% at 6 months. Now, that doesn't say it doesn't work, and there are some people who I've had on it it works very brilliantly for, and so it's certainly in our list of things that we can use, but generally not first. The other limitation with Vivitrol is that you have to be off all opiates for a 2-week period prior to starting Vivitrol. So certainly if someone is suddenly starting to try and quit, Vivitrol would not be a good choice because they would have to be sober for 2 whole weeks before we start. It is also used for alcohol use disorder. Similar efficacy in the 10 to 15% success rate within 6 months. I have had people who've responded to it extremely well and been able to get sober when nothing else works. We believe that what it does is it decouples the dopamine release, the pleasure response when people drink alcohol, so it's a lot easier not to drink. And in that case, it can be a very effective medication. It's quite safe. It is an injection. It's given once per month in the doctor's office. That is part of an inconvenience with it. It is relatively expensive, about $1,400 a month if your insurance doesn't cover it. But if your insurance covers it, it may be affordable for you. That is another option that we have in treating addiction. And the more options I have, the better as far as I consider that. If you have any questions about this, be free to call the office or arrange a visit. Thank you very much, and goodbye.